नमस्कार. आयच्या खाशेल्या कार्यावळीन तुमकां सगळ्यांक येवकार. आयज जे आमच्या वांगडा मानिस्त आसा ते एक हार्ट सर्जन आसा आनी जेंच्यांनी जवळपास 30,000च्या वयर अशे शस्त्रक्रिया केल्लेले आसा. त्या 30,000 भितरले 8,000 हे गोवन पेशंट्स आसले आनी भितरली भुरगीं व्हडलीं अशीं पेशंट्स आसले. आयज ते बेळगांव हांगासर अरिहांत हे एक नवीन हॉस्पिटल चालू करपाक सोदता. मेळया डॉक्टर दिक्षीत हांकां. डॉक्टर दिक्षीत, वेलकम टू आवर शो.
Oh, thank you.
Sir, just tell me how you chose cardiothoracic surgery.
When I was doing my general surgery in 1980, late 80s,
Yeah.
at that time heart surgery had just started growing in all over the world and also in India. So because it was a new branch, I got fascinated towards it. And then I was lucky that I got an opportunity to learn cardiac surgery in Bombay
Yeah.
with the stalwarts like Dr. Nimisha. And with his training and all, we started getting interest in cardiac surgery. That is how I got into cardiac surgery.
Okay. Many a times people get confused about the cardiac surgery or the cardiac surgeon and cardiothoracics. What is the difference?
Cardiac means mainly related to heart.
Okay.
Cardiothoracic means related to chest, which includes both heart and lungs, and also sometimes what we call as the gut, that is the esophagus, that is the small this bowel which we when we take food, it goes through the pipe. So it's a food pipe.
Yeah.
So either a food pipe, wind pipe, or lungs and heart, all they come into cardiothoracic. Cardiac means only heart.
Okay. So as I mentioned earlier, 8,000, around 8,000 people you have treated of Goa. Any memories or any other thing you want to tell?
No, I am very grateful to the people of Goa because they were the first people who were able to have faith in our treatment.
Okay.
Not before anybody else could have it. They were the one who were able to have faith. And they used to come all the way from Goa and they used to stay with us. We used to operate them. And Goan people, they are always loving people and they have got good wishes for everyone. So I had developed a special bond with Goa, and that is why even when I had left Belgaum and had gone to Bangalore, I used to visit Goa regularly. Even now I used to visit Goa regularly. So we have operated a lot of patients, and Goa is like a second home to me. So the people of Goa, I know a lot of people in Goa, and we are ever grateful that they trusted us and they had faith in us.
As I mentioned just now about the Arihant hospital, you want to start in Belgaum. Just tell something about it.
What happened is after some times we realized that if we had to deliver the health care, we should, I felt that I should have my own hospital.
Okay.
And with the help of Arihant group, which is owned by Rao Saheb Patil and his children, Uttam Patil and Abhinandan Patil, we came together and we built this hospital, which is a ultra modern 100-bedded hospital. Mainly our priority will be on heart surgery in this case. Also angiogram, angioplasties, everything will be done. We are also looking at having a tie-up with some people where we can do joint replacement, spine surgeries and neurosurgeries. So overall, the whole idea is that now I will be available only in one place, that is in Arihant Hospital. And I look forward to treat any of the patients who want to come and visit us.
Okay.
So the whole idea is to remain in one place because last 5 years I've been traveling to Bangalore, Kolhapur, Goa, everywhere. And but then I decided that once I have my own hospital, I can be here, be available 24/7 to the people.
Thank you, sir. It was nice meeting you. All the best for your future ventures and future journey.
Thank you very much. Uh, Before I say end this program, I just wanted to inform that nowadays we see a lot of young people having heart attack, lot of having heart diseases also, developing diabetes, hypertension. These are all lifestyle diseases. Lifestyle in the sense that we lead a very unhealthy life, and that is why we get all these problems. So the best way to lead a healthy life would be, it's a simple, but yet we find it difficult to implement simple things. The best thing is avoid smoking, tobacco in any form. That is first rule number one. Exercise, walking is good enough. 1 hour walking, half an hour going, half an hour coming. That is good enough. Eat 2 to 3 times a day. Don't eat too much also. If you restrict yourself to breakfast, lunch and dinner and avoid eating in between, you will maintain a good weight and a good health. And smile all the time. Life is too short to be worried and be stressed about. So enjoy. The only principle only philosophy I would say is that any problem which is there, it's not going to be permanent.
Yes.
Either joy or sad, it's not going to be permanent. One day or the other, it's going to disappear. So why worry about things which are not going to be permanent? What is permanent is our mind, our happiness. Concentrate on them. Be happy with whatever you have and enjoy life. That's all I can say.
Thank you, sir. I am sure that people who are watching this episode will take the things you have told in mind and will work towards it.
And I wish a happy Ganesh Chaturthi and happy Dasara, happy Diwali and happy Christmas to the people of Goa. And we are always at your service.
आम्ही सध्या आसा बेळगांव हांगासर आणि आमच्या वांगडा आसा प्रभू हलकट्टी जे एक नामनेचे असे डॉक्टर आसा. सर आमच्या ह्या कार्यावळीन येवकार. Tell us something about the angioplasty cardiologist.
No, basically when patient comes with chest pain, we always has typical tightness in the chest, sweating, vomiting, and pain sometimes in the jaw. So त्यावेळेला we take first ECG. That is the most important thing. And moment we see that, we do an echo to confirm that this particular patient has got a heart attack.
Okay.
So what we in our hospital, Arihant hospital, we do is, we take them straight away to the cath lab to do what is called as primary angioplasty.
Okay.
Otherwise, there are two options. One is to give an injection that is called thrombolysis to remove the clot.
Okay.
We lyse the clot. Means clot सगळं ते clear करते.
Okay.
That is one method. Otherwise, the best method nowadays, we always tell everyone also, primary angioplasty म्हटलं तर, we take straight away to the cath lab, do an angiography, and remove straight away the clot and put a stent. So this is very, very important because we know 100% clot can be removed by primary angioplasty. Okay. So we always explain even to the physician, this is available in our hospital. Next step is injection, and then later on we do an angiography, that is after 48 hours.
Okay.
So these are the two methods for patient coming with an acute heart attack.
Okay. So on the ECG, you come to know that how much is the heart block, or how much is the
ECG will not give a percentage of block.
Okay.
ECG will tell only that he has got an heart attack, whether it is the anterior wall of the heart or inferior wall or posterior wall.
Okay.
The diagnosis of blocks are only on angiogram. The gold standard test for knowing the block is coronary angiography.
Okay.
Okay, we have some other methods called CT angio, but this is the gold standard test to know whether percentage of block is 1, 2, or whether it is 80%, needs to be removed immediately, or he has to be sent to Dr. Dixit for a bypass surgery.
Okay.
If the blocks are more than 3 or 4, if the length of the blocks are very long, we cannot do an angioplasty.
Okay.
So it will go to surgery. Dr. Dixit will take care of them for open heart surgery. Other than this, we do also here a balloon valvotomy where the valves are narrowed. Either they will be replaced if the valves are damaged very bad, or we do a catheter based. We put a catheter inside through the groin into the heart, and the valves are opened. This is called balloon pulmonary or mitral valvotomy. So valve can be made bigger by putting the balloon. We just open the valve and then remove the balloon.
Is there any risk involved?
No, maybe less than 1%.
Okay.
Sometimes they collect the blood around the heart. So immediately we put a needle and remove the blood. That is one technique. Another thing is sometimes the patient comes with a hole in the heart, which is there from since childhood. So if the particular size of the hole is small, we put what is called as a device.
Okay.
So we put a device inside and close it without opening the chest.
Okay.
If it is a large hole, then Dr. Dixit sir will take care for open heart surgery. Without that, if it is a small one, we have got ASD, VSD, PDA. All those things can be closed with a catheter technique without any operation. So we have done those things also. We are planning to do, one child has come, 6-year child. Next week we are planning to do that PDA closer with the device. So device is without opening the chest.
Okay. How much is the technology used in this? As in, like before, it was very difficult because there was not much technology. But in nowadays time, it is just a times passing. The technologies are improving. So how easy or difficult is to diagnose it or treatment?
No,
technique?
basically starting from even the machines what we have got, cath lab, they are all high-end machines. The images what we see, the stent, we have got something called stent booster. Means earlier we never used to see the stent very clearly.
Okay.
The technology has improved so much, we have got a stent booster where stent can be very well seen whether it is opened very well or not.
Okay.
And all the wires have come different, catheters have come different, stents have improved in the technology.
Okay.
And other than that, we are getting another machine called OCT, that is called optical coherence tomography. Earlier what we used to do, we used to do an angioplasty, put a stent and do an angio, okay fine, we are happy. But sometimes stent is not opened fully, which we can see that by doing this particular technique called optical coherence tomography. It has got a ultrasound wire at the tip of the catheter. We put that ultrasound wire inside the artery and it takes the image. So whole image can be seen on the screen, my stent is opened fully or not. If it is not opened by this OCT, again we go with a bigger balloon and open it. Why it is important? If my stent is not opened fully, this fellow will come back with a reblock again in a short period.
Okay.
If I do an OCT, I know that I have done an optimal opening of the stent. So this fellow will never come back with a reblock. So this also machine we are already ordered. We may be getting it shortly, which is called OCT machine. Okay, we have recently, I think sir must have told you, there is something called Rota Pro technique. This is the first case which we did in North Karnataka in our hospital. Okay. About 2 weeks back, we have done 2 cases where the coronary arteries are hard, calcified. So there we cannot put a stent. Once there is a heart like a stone, we cannot put the stent inside. There is something called a diamond cutter. It's called Rota Pro. We have a machine, still it is lying there with us because we are trying to buy that new one. So we have done 2 cases of that where the calcium is cut. It drills, literally it drills at 160 RPM, 180 RPM. So the calcium is removed and then it is easy to put a stent. It is called Rota Pro technique. It is just like a angioplasty but advanced stage for case for calcified arteries. We have already done. This is the first case. I think we have already reported. I think you already given in all about Belgium and we have put it in paper. These are the first technique which is done in our Arihant hospital.
Okay. थँक्यू सर.
Thank you very much.